There's been a lot of discussion around health equities in marginalized communities. And here at the National Forum for Black Public Administrators, many experts are looking for active changes we can make in our communities. Joining us now is Cigna sponsor Reggie Crenshaw. Thank you so much.
Thank you, Andrea. I'm so glad to be here. And it has been a wonderful event that we've had here. I'm so happy to be in an environment where people are really concerned about health equity and how that impacts their communities, particularly like marginalized communities that are urban and both rural. As you know, a lot of people don't understand that the same impacts that you feel in an urban community, you feel them in a rural community.
Yes.
Because access is an issue, no matter where you live. One of the things that's very interesting to us, and I come out of the Tennessee area, is that for OBGYNs, you may have in a rural area no OBGYNs, and it'll take you like 2 hours to drive to get to one.
And those are typically called health deserts, right?
That's right. And then you also have deserts where there are no hospitals. So I think it's really one of those things that a lot of people are not familiar with. They really think about equity as being something that is urban and people who don't have a lot of funds and very marginalized, as opposed to the fact that marginalization happens in many different places.
In many different forms.
In many different forms, and it's our responsibility as citizens, as a community, even public administrators, to be able to bring the resources to people who otherwise wouldn't be able to have them.
And like you said, there are many different kinds of deserts. Health equities appear in many different forms. It manifests in many different ways. And that could be something from funding to treatment.
Exactly.
Patient care. There's a lot that we can do to change the health sector, but I think a lot of times for people who are elected in these positions, when we are looking for active change, where should they start?
Yeah, so one of the things that I would say is you have to partner with corporations that tend to have your same values, same vision. At Cigna, one of the things we've done is we've provided telehealth as free as a part of the offerings that we provide to you.
Is that across all networks?
That's across all networks. So MD Live is what we use. So when you dial into MD Live, as long as you have the Cigna healthcare services, generally speaking, MD Live is free. Versus some of our competitors, you actually pay for their telehealth services. Our reason for doing that has a lot to deal with health equity. We don't want there to be an impediment for someone saying, let me call someone and get help. If you can call them or you can video them, you can get help, especially if you live in a desert where those resources aren't available. Also, the second thing that we offer is home delivery of pharmacy, medicines. So for people who don't have cars or not able to get to where they have to go, you have your medicine showing up at your home. It takes that worry away from you. So when you think of like health equity and the importance of it, you have to meet people where their need is. You can't force a person to say, I need to get on 3 buses just to get to a doctor, and I show up like an hour late because of all the connections that I have and I miss my appointment. You have to figure out ways to address those concerns without going through the normal channels.
What is next for your company? What else would you like to see?
What's next for our company is we have doubled down on being very active in the community. I know at Cigna, we've given so much in the community by way of being connected to a lot of the community organizations. We do a lot of volunteering, but most importantly, we do a lot of heat maps for all the areas that we serve, which kind of talk to the deserts and how people feel in different areas. So when we deal with a lot of that as a critical component, we're really passionate about bringing healthcare to everyone. As you know, we have individual and family plans that you can get off of the exchange. We have plans that you can get through your commercial side. We also have plans that we provide through the public administration side, so local, state, and federal government. We're just really excited just to be a part of what we do. And in this public sector space, we have over 3 million members in the public sector, which is really amazing because we have a huge commitment to the public sector.
My last question for you, for public administrators who are attending conference or even those attendees who may not be directly connected to health fields, what can we do to really help solve this problem?
I think one of the things that large cities have an opportunity to do is do a community health assessment. By doing a community health assessment, you can understand what those priorities should be for your community. All work that needs to be done around healthcare needs to be public, private, community. You need to engage everyone. One of the things that's really important about engaging people is to bring in trusted resources so that those trusted resources can let people know why it's important. During COVID, one of the things that I had a chance to lead was a awareness program around COVID. You would be surprised that the statistics showed in the area that I live that 68% of the people didn't trust the information that they were seeing online or through the television. They only trusted when someone that they trusted told them about it. So the way we did it was we engaged with agencies, community leaders that they trusted, told them that here's what you need to do in order to be able to take care of the things that could affect your health. And then all of a sudden in 9 zip codes that were averaging 9% in vaccination rate, in 15 months they went to 40% vaccination rate, all because the level of trust went up. So my main thing that I would say is we need to work on building that trust factor from a public administrator side, and that means partnering with groups of people who have already earned the trust and then bringing those resources that can actually develop a better outcome for the citizens in those areas.
That is wonderful advice. Thank you so much for joining us.
Thank you for having me. I appreciate it.